while he sleeps, and it takes about 9 hours. Okay? That's the disadvantage, is that it is a long treatment, but it's done while you sleep. You don't have to show up over here. There's none of that stuff. He'll be expected to come in here twice a month.
Okay.
First part of the month, he comes in and has monthly labs drawn, foot checks, whatever we need to do to meet the Medicare expectation. That is done on lab day. And then Dr. Taylor will most likely continue being his doctor. We have two doctors here, Dr. Fisher and Dr. Taylor. And usually the people that come from Ensign are Dr. Taylor's patients because they already have an established relationship with him. And what we're going to do today is flush his catheter. And all that does is put the fluid in and take it out so that we know it's working.
Right.
Okay? Part of this process is he had Dr. Petrozello that did his catheter. So the first part I have to do a sterile dressing change, transfer set change because he doesn't add the end piece. What we're doing today is called the manual exchange, and there are two ways to do PD, manual and cycler. The manual you'll have on hand, you'll have enough to do in case of things such as we just had a hurricane. People lost power, they need dialysis. Versus people that are hemodialysis patients, if there is no power here, they have to be shipped somewhere. Dialysis must go on or people die. So PD also is more gentle. That's why it's a longer kind of treatment, and it's why it's done every day. And what it also does is it preserves whatever kidney function you have.
Mm-hmm.
If you think about it, have you ever heard that expression, if you don't use it, you lose it?
Right.
When you go to hemodialysis, that is a life-saving treatment. But what it does is it completely takes over the work of the kidneys. And eventually, the kidneys just say, I'm not needed, I'm not doing anything else, and they don't. With this, we want to maintain whatever kidney function he has as long as he can, because what it does, it buys time on the other end. We want him to live a long time, and with this, he can have a real life. This could be done anytime you want to do it.
He wants that nighttime.
You can do it at nighttime. You got something to do tomorrow night, you can get up tomorrow morning, do it again in the morning, do the next days in the morning. But you got to get your kidneys cleaned out and your body. So it doesn't matter. You have a lot of flexibility. He will be in charge of when he wants to do it. We have different fluids we use, different strengths, and you have so much to learn. It's so exciting. Based on his weight and his blood pressure, he'll decide what fluids he wants to use and what he needs to use based on how much fluid he needs to pull off, and he's going to be in charge and he's going to know how to do that. Okay. And when he starts training, anybody that wants to come and learn to train can come. This does not require you to have a partner, but I just believe the more people that are involved, the better it is, because some nights we are human beings.
Yeah.
And some nights it's crap. I don't want to do it. I'm too tired. And that's the bottom line. And then if somebody come in on those nights and sort of help them out. Okay? All right. My name's Pat. I met your wife the other day.
Yeah.
And I'm sorry, I am moving this weekend. And I have one uniform in the closet. And my name tag is on the one from yesterday, but it's all right.
You'll get that.
I showed up. Let me undress you. See what we got in here.
Did they clean? No, they didn't take it off.
I didn't say nothing about it.
What, the dressing?
Yeah.
Oh, no, you don't take it off. We take it off.
Yeah.
You don't want,
Wait, Dr. Prezzelli, whatever you call it, he said that, he was gonna look at it, but that needs cleaning.
Yep. They said he had a lot of adhesions, and basically what adhesions are little scar tissues in your belly. I don't know if he's ever had abdominal surgery or whatever, but some people, it's just part of it.
Right, nope.
Well, you have it on backwards, but it doesn't really matter. Anytime that he does an exchange, anybody in the room needs to wear a mask, okay? We don't want animals sleeping with him at night, if y'all have any animals. And the reason for that is those little critters, what is in our solution is a sugar solution.
Mhm.
So they're attracted to it. And we've had cases of cats and dogs where they've chewed the dialysis catheter.
Oh my,
And then you're in a whole new world of hurt.
oh my.
So they said he had quite an extensive surgery.
Mm-hmm.
And if y'all, at any time, just look through that PD book, you'll see it's written on the 5th grade reading level. That's unfortunately what the average American reads at. And there's a lot of basic information in there about diet, you know, and the medicines
Mm-hmm.
and stuff like that. That's the book that we use to train you. Training is usually 6.
Do I get to keep it?
Yes, darling. Training is 6 to 15 days.
Okay.
We usually do a week working with the manuals, because that's your emergency rescue. When you learn how to set the cycle up, there's 4 steps. That's the easy part. And what we usually do is when people come in, once you get the manuals and you feel like, oh heck, I got this, we move right along. So for some people it's 6 days, some people it's 15. The average is 10. And we usually do 4 or 5 hours, depending on if I train you or Christy. Christy takes a little bit longer.
Okay.
I'm a firm believer that the average adult learner 4 hours is about what you can take sitting in one spot. So you have to wash your hands for a full minute, and you always put your mask on first. Y'all don't need to learn this today. You put your mask on first, because if you wash your hands first, you put your mask on, then you run your hands through your hair. And you always want to make sure you control the air. So you don't want any fans or air conditioners running during connection and disconnection. Once he's connected and disconnected, because anything in the air is kind of like, I don't know about you because you're a guy, but we can tell you, you can clean and dust and your house is good, and you can come home in the afternoon, there's dust again and there's no windows open, and where'd it come from? It's in our air. And what we don't want is it to get in his catheter. Okay. When he does this, if he does it himself, he does not need to wear gloves. But anybody else would have to wear gloves, because what's his bacteria and his body is okay with isn't necessarily ours, even though y'all related. How's your pain? I heard you went back to the emergency room the other day.
Whatever. Track urine infection, what you call it?
A urinary tract infection?
Yeah. That's what I went back for.
Do you still pee?
Yeah.
Okay, good. The longer you can pee, the better you do. And this is the actual dialysis catheter. And we put an extension on here to hook it up to our machine. But the catheter actually goes in and over and is pointed down. Excuse me.
Can you see what's up?
The solution that we soak this catheter in is a bleach solution. We have 2 types. There's a blue bottle, and this is the one, Alcavis, high level disinfectant. This is the one that we soak the catheter in. This Accept is the exit site. We clean around his wound with this. This is less strong. but it's still a bleach solution. And you will get 500 blue pads in your supplies, and we encourage people to use them. A lot of people don't. But if you don't use them, you're gonna get bleach on your clothes, and don't come holler at me, cause I told you to use them. Okay?
Yeah.
Now, we want this to soak for about 2 minutes, so while that soaks, I'm gonna kinda clean up the mess we got going on here. And you'll be doing your, this is called your exercise. You'll be doing your exercise care every day.
Right.
Most people do it when they get out of the shower, standing in front of the sink, in front of a mirror. And what you just need to remember is, don't go back over with the same cloth where
Right,
you've
right.
been. If you wash down below and then come back up to the top, any bit of the skin down there, you could pick something up
Right.
and bring it in here. It's still oozing a little bit. This one is just to dry. When this quits bleeding, I'm gonna teach you about the rules of 4,
Right.
where we have 4 2x2s out. And we always here put gentamicin cream, and this will come from our pharmacy to you. If you ever run out of this, call us when you start getting low, and we order it for you. But you can use a triple antibiotic cream, but not an ointment. Most of them are ointments. But the triple antibiotic ointment, and I don't know the pathophysiology, but somehow it will interact with the catheter, and over a period of time it wears down the catheter. I guess the difference in a cream and a, whatever the other thing is. Yeah. It just takes a little tiny dab. You do it like that so that the whole exit side is covered with gentamicin. And you want your dressing underneath the catheter, because underneath the catheter, that's where it's going to take the longest to heal, because the catheter is pressed against it and it'll stay open right there longer. So we want to make sure nothing can get in, because all the same things we're saying about controlling our environment, we got to control this. This is the first line of defense. When this completely closes up, it's going to look like a pierced earring. Okay, it will close right tight around it. But until that time, we got to protect this belly, because we don't want any infections. I didn't lay my things out very well. They just kind of, this is what they call a window pane dressing.
Uh-huh.
You want the middle not covered,
All right.
but around the edges you want covered. Down at the bottom, you kind of just make a pinch to anchor it. Just like that. Okay. Now I have to do the sterile end piece. Dr. Petrozello, for some reason, does not put the catheter on it, the transfer set. It's not a problem, it's just that it's done sterilely, so you sort of have to change horses.
I can't take these things here off.
You can. I don't know that I would yet. The reason I say I don't know that I would
Right.
yet is because that thing is still trickling blood there.
Alright,
And those things usually they put glue in there and it's usually not a problem. But when it starts coming up on the end, yeah, you can take them off. We provide everything you need except a bottle of Clorox,
Okay,
okay, and paper towels.
I already got that towel.
We provide your hand soap and your hand sanitizer. Now your hand sanitizer will come from this clinic. It does not come with your supplies at Fresenius. But if you ever run out of hand sanitizer, it's the weekend, you can get hand sanitizer from somewhere else, but we just ask you don't get something like Bath and Body Works, something that has a smell in it, because that may be aggravating to the wound. But we'll even give you your soap and everything. And your first shipment will have about 60 boxes. It's a bunch of stuff. If you have room, if you don't have room, we can do a 2-week shipment. But with the first shipment, you get like 37 days worth, because we have to anticipate in the event of a catastrophe that not only do we need to worry about you getting supplies, but where's the catastrophe that it may be where our supplies are coming from.
Right.
y'all ain't gonna see the preps this morning,
Do what?
y'all ain't gonna see the preps this morning.
Are you hungry?
I can get that way.
No, if I'd known I needed to bring you some, don't touch it, don't touch it, don't touch it. That's our sterile feed. You will see that the most important thing you're gonna do is do your hands. This is the only day it takes this long, because this is the only day we have to add the transfer set. Usually, this procedure usually takes about 30 minutes.
Will we be dealing with transferring the transfer set at home?
No.
Okay.
Nope, you don't have to do that. All y'all be doing at home is the treatment.
Good.
Everything else that comes up, y'all call us. If like if ever has a problem with this catheter, we'll fix it. And I will review with y'all as we go along some of the issues that can happen, and
Like if the lights go out and no power.
well, then all you do is go doing your manuals. That's why we spend a lot of time on the front end making sure people get that part of it, because that's the part that people, and even after they learn it, they don't like doing it because now they've learned the cycler, and the cycler is so easy. So sometimes we have to sort of remind people how to do it, and that's okay. Okay. We've had a 2-minute soak. All right, now you're real, my friend.
Alright,
Now we can get to the meat of the matter. Now, before y'all came in today, I added some heparin to my solution. Now, heparin is an anticoagulant. And a lot of us who are familiar with heparin know it's used to treat blood clots and such.
Right.
But this is a low molecular weight heparin, and it does not cross over out of the belly. And I will teach you how to do that also. My hand sanitizer. When we check our bags, we check them for scale, which is SCALE, the solution, the clarity, the amount, is there any leaks, and the expiration date. And I did all that this morning, and it's all here. And to check for leaks, you just squeeze it. You know, you don't have to, it's not gonna break. To open this one up, it opens just like that. It's like a puzzle. And it fits right into here. And this goes right into here. And then we're gonna connect after I re-hand sanitize.
So that's all there is. That's all it is.
This is the manual.
Isn't there a longer cord for him to sleep and do this on it?
With the machine,
Yeah.
Uh-huh.
like you don't do this one at night. The machine, it has probably
Okay.
10 foot. You know, so they can turn over and get comfortable.
Got you.
You have a layer on your back, I had a job.
I heard that you had back trouble.
Yeah.
Yeah.
So how long do you stay in bed at night?
I turn and twist on at the nighttime.
Oh, I do too.
I-
That's okay, you have,
I stayed up 8 hours, 9.
okay, well, you'll be fine then. You have enough cord to turn and twist. I always do the extended lines because I move a lot myself.
Right.
So I have to fix people's supplies based on what I know. So
Right,
that's what I know. All right, to connect. This is so easy. You unscrew one, unscrew the other, and move this to here, and this to here. And he's now connected to his fluids. And the first thing on any dialysis is drain. He probably doesn't have a darn thing in there. He's got a little bit, but probably not enough to really amount to anything.
Mm-hmm.
So you would say, normally you would give that, 10 minutes or so and see what happens, but this is his first flush, so we know he doesn't have any. There's a little piece of plastic up here. You break it, turn it, and this is a step 1, step 2, step 3, step 4 situation.
Okay.
We go to flush and count to 5. 1, 2, 3, 4, 5. And what we want to see is the fluid run into that bag.
Mm-hmm.
And then we know that what that does, it clears the air out of this line. Otherwise, if we skip flush, I'm going to tell you what happens. Chest pain. That air goes right into your left shoulder and you feel like you're dying. And that's it. Now, today we'll probably only do about 500. We'll do it in a few flip backs, so y'all don't need to remember how to do this because this isn't going to be the normal way.
Right.
Because we want to get fluid in and get fluid out. So far, so good?
Mm-hmm. If I can remember all of it.
Oh, you don't have to worry about it. You're not even, this isn't your learning. You're just here hanging out with me today.
Okay.
All right? And you can put your mask down till we disconnect. Because it's hot. So, yeah, this is just, I like to talk while I'm doing it and kind of explain things. It seems overwhelming.
Mm-hmm.
This is a very simple process. This is a little more complicated than the cycler, but it's easy. But the implication is serious.
Right.
And I can tell you all day long how easy it is. This is your loved one,
Right.
and this is his life.
Right.
Okay? Therefore, no question is stupid. If you've asked it 150 times, if you need to ask 151, do it, okay? It doesn't matter to us. We want you to understand at whatever level you need to understand. You know how some people you have to get at the ground level? That's how I am about learning anything. Let me get to the root of the matter, and then I can add up learning from that. Some people can just accept things and go with it. I'm not like that myself.
I'm not like that.
Yeah, but all we know is how we think. Let me know if you start feeling uncomfortable.
I will.
All right. Your socks and my socks are almost the same color.
It's ugly color they
And
wear.
ain't neither one of us wearing nothing to match, so we are fashion forward.
That's right.
We're making our own fashion statements. Alright, now, drain. Y'all need to worry about this part, because what I'm doing is flushing it out.
Okay.
When y'all do this, you'll fill the whole bag up and then disconnect.
Well, it won't be bloody like that, will it?
Oh, absolutely not. Right now, he had a lot of adhesions, they said,
Yeah.
which means there's a lot more manipulation. And usually, the first couple of times, it may have a little bit of blood in it. And that's one of the reasons that we flush it out. Blood, well, we know what blood is, but it can actually cause inflammation.
Mm-hmm.
You know, because it's not normal for it to be there. It's
Right.
normal to be in a blood vessel. So what we want to do is get rid of that blood. And you know what the treatment is so funny? Heparin,
Yep.
which is an anticoagulant. What blood will do, they have a thing that your body makes called fibrin. And it's normal part of the clotting process. And for some people, he's got a catheter in him that God didn't put there. You don't have to be religious, but you just
Yeah.
have to know
Yeah.
that God didn't put it there, so the body don't want it there.
Right.
So it's trying to make an exit, something to push it out. So the fibrin, some people have it all the time. Some people have it sometime. Some people have it when there's inflammation. And one of the first signs of an impending infection can be inflammation. So we pay attention to fibrin. But the reason that we use heparin to treat it is heparin doesn't make it go away. Heparin doesn't make your blood clot go away. What heparin actually does is stick the blood clot over here so that the blood can keep going by and your body gradually reabsorbs it. But in the abdomen, and once again, this is a very low molecular weight heparin, and it's a very small dose. It's just enough to work in his belly, but those molecules of heparin are too big to cross over
Right.
in his catheter to the rest of his body. So you don't have to worry about falling, having a head injury and bleeding or anything like that. It's not that much heparin. Did it hurt when it was draining out? Okay.
Yeah.
Generally, if people have any discomfort, especially men, it's with the drain pain.
Mm-hmm.
But and it's where the catheter is, they feel like their testicles are being sucked out, and that's what they say. But once the catheter's in and settled and the body's kind of adjusted, it's usually not a problem.
No, I didn't feel that.
Well, that's excellent.
And what you doing now? What,
I keep turning it back to drain. I don't want to leave a bunch of fluid in, and what we don't want to do is stress the abdomen. We want it to get better.
Right.
And his normal dose of fluid will be that bag. That's a normal serving. But if we put too much fluid in here and it starts leaking out that exit site, if something can get out, something can go in.
Yeah.
You know, so we want to use just a little bit, flush it through until the site heals up completely. And we'll do this about once a week. It won't be on Saturdays because I just was happening to move today and you had that appointment yesterday. It didn't matter. We don't usually work on Saturday, but probably one day we'll do it in correlation with his dialysis. Now, I will tell you that I will be his advocate trying to get him over here as soon as possible. Because once again, you don't use it, you lose it.
Right.
We don't want people on hemodialysis, and we don't want them to have to go back to hemodialysis.
Right.
We want to preserve that kidney function. End-stage renal disease is a progressive disease. It doesn't get better. It only gets worse, and the best thing we can do is save the function that we have.
Right.
So we always try to get the hemo patients here as quickly as possible because that's our ulterior motive. I'm all about the PD.
Yeah.
And usually people feel better because it is gentler. You know, a lot of times when they have hemodialysis, they are exhausted when they go home, and the next day they are just tired. The next day they have to do it again, and by the time they have the day off, they have a whole day of waste products building up.
You let a mouthful in.
I'm gonna tell you something. I used to tell my husband, if I ever have to go on dialysis, let me die. Everybody was a bitch. And now I actually do dialysis, and it's many years later, and I see there's been a lot of progress with dialysis. That's just how it used to be.
Right.
And the patients tend to be real grumpy. And now,
Yeah.
it's not as bad as it used to be. And I don't want people have to have those feelings of feeling that bad. I mean, they feel that bad. They really feel as bad as they act like they feel.
Right. They still feel grumpy though.
Absolutely.
One thing about it, you can't do that day when you have it.
Well, you ain't gonna have to worry about that, because pretty soon, I had a girl, I'm not lying to you, she was doing hemodialysis. Every time she had a treatment, she had seizures. She didn't have a seizure disorder, it was her body reacting to the stress of the dialysis. And I just said, she needs to do PD. I was scared of her too. I mean, every time she came to the clinic, we had to call 911. But I just said, that girl, she's 40 years old. She needs PD. So I talked to the doctor, and he agreed to let her try PD. And he said, Pat, don't let it hurt your feelings. It's not going to work, but there's nothing else we can do for her. I mean, we're just at the end. First day she came and sat in my chair, she had probably like a 15 seconds. That night she went home, and for the first time in 1 year, she had had a new mobile home that she had had a whole year. And she walked up those 8 stairs into her house by herself, and she came in the next day crying. And she said, I had no idea I would ever see this day, because by the time she came home from dialysis, she was just so done.
Yeah.
You know, and worn out. And fortunately, God bless her, she got a kidney. But I mean, it makes a difference, and it makes a difference quickly. For the average person, it's probably going to be a couple of weeks. For her, it was immediate. But once again, she was the one, you know, the doctor had said, there's nothing else we can do.
Give up on.
Don't be hurt, you know, don't be hurt when it doesn't work.
Well, we know this is gonna work.
Yeah. It absolutely works, and there's so many variables that we can change. You know, we can change the amount of fluid he gets, and we can also change the time that it dwells in him. You know, as we go along, every 3 months we do what we call an adequacy, where you bring in 24 hours worth of fluid and 24 hours worth of urine, and we draw some blood and we send it to the lab, and it computes out, and I don't know how it's done, based on his weight. And I guess the stuff in the dialysis, the kidney products, and the urine, and is this adequately cleaning his kidneys? Because regardless, that's what we need to do. And then when we get those back, we make adjustments all the way along, so we want people to stay on PD until they absolutely don't have any other choice. Just because it is better. It is so hot in here today.
You having hot flash?
I don't think so.
Are you hot?
Not in this outfit, I'm not.
Okay.
Who you?
Maybe it's just hot to me.
But keep moving.
How long is it usually between this stage and when he can get off the hemodialysis?
As soon as Dr. Taylor says I can move him. It's usually within a couple of weeks, because what we do, like today, I'm trying to put about 500 in at a time. When he comes next week, I'm going to put 1,000 in. The next week, I'm going to ask Dr. Taylor, can we go ahead and get him over here? We can be doing 1,500, and we can work our way up, but get him off of that. And it really depends on how his exit site does. Because like I say, that controls exactly how much we're comfortable putting fluid in, because you don't want it to leak.
I know he goes Tuesday to Dr. Petrozelli.
Mm-hmm.
To get checked out.
Alright, so Tuesday won't be a good day to flush him. So we'll try for Thursday.
Cause Tuesday, it's in the afternoon, but.
That's too much of a day.
Yeah, yeah.
But like I say, when he comes back next time, this will be about a 30-minute deal.
Like I told her, I said, they try to put too much on in one day.
It's difficult.
I have been to $3 in one day for this.
Well, I'm gonna promise you something. By the time you get doing this, all those appointments won't bother you, because you're gonna have energy. You're gonna feel good.
Good. Now, if I feel good or die, don't make no difference.
Oh, no. If I decide it's alright for you to die, I'll let you know. But until I give you the heads up, your answer is hell no. I mean, and that's not on my agenda.
Now, see what I've been trying to tell you?
But I'm gonna do my best.
Okay. And I'm gonna do my best to help you.
You got a card so I can call you?
You can call me anytime. You know the number over there, the other dialysis clinic? I don't have a card.
Oh, okay.
Oh, but when you go, you mean when you go home?
Yeah.
Oh, when you go home, you're going to have all our numbers. There is I'm trying to make sure I can see when this quits stripping. There is a nurse call 24 hours a day. During normal business hour, we do have a separate number for them, but a lot of our patients just call through over there. There is also a technical support. There'll be a number on your cycler. That's what our cycler looks like.
Mm-hmm.
And there's a number up there if you have any machine problems, and they're available 24 hours a day. So you are never by yourself. And that is one thing this company promotes, is we want you to know.
Yeah.
I had one lady in Newbern, and she called me 21 nights in a row. But you know what? Her daughter had come up and learned the machine with her.
Uh-uh.
Then her daughter went to Alabama. Now she's home by herself with her anxious neighbor who thinks, oh my God, we need to go see Pat. We need to go see Pat. I did go one night. Night 22, I called her. Sudie, you ain't come. I got my machine. I got it, Pat. I got it. But it was just, you know, she felt comfortable and confident. And every night it was the same thing. I don't think she needed me, but she thought she needed me, and that was fine with me. I tell people all the time. I've had other patients call. I say, look, you just need to talk, because I ain't doing nothing. I don't care. I'm one of those people. We're in a triangle. You, me, and Dr. Taylor.
Good.
You know, and we got to keep the communication right, and I'd rather be called than anybody make an assumption and assume wrong.
Right.
You know, because it is serious.
Mm-hmm.
Like I say, this is a very easy procedure. The implications are serious. You know, so we don't want to make light of anything.
Well, you made me feel better.
So, yeah. And I'm generally on call. And you know Kim,
Yeah.
our manager?
Yeah.
She's always here, and Christy's the black girl that works over here. She does PD too. And then we have an excellent PD nurse in Kinston named Molly. Molly and I are usually the ones on call. But usually, like, if somebody needs to come out and see you at night or something, even if Molly's on call, I would come. You know, she'd call me and I'd come, especially now that I live here,
Right.
for one whole night. Our movers didn't show up yesterday.
Uh-oh.
And I'm going to tell you what,
I'm losing a job.
It is, and I was at work, and my man was there trying to take care of the moving. He had a whole crew coming, nobody showed up. And he volunteers for the Red Cross. So he got one of his Red Cross buddies and one of my daughter's boyfriends to come help him load everything up. And then today my daughter and her boyfriend are coming this afternoon to help us unload. But we made us a pallet on the floor last night. I'm 60 years old. I think I've outdone the pallet stage. Because the bed was in the center of the truck, and I'm just like, eh. By the time they got here, it was just too late to mess with that.
I understand.
But tonight I'll have a real bed. Yay.
You can sleep better.
Mm-hmm. Do you know Rainey Singleton?
Oh, I'll be telling her.
Yeah, she's a lawyer. I'm renting a house from her, and her father was born in this house.
That means it's over there, no?
I love it. I grew up in an old house in Williamston. I'm from Williamston
Yeah.
originally. And I don't know, it feels like home to me. And my boyfriend's like, I wonder if this is lead paint. I'm like,
What part of Williamston?
I grew up, you know where the Presbyterian Church is?
You know where it's at?
On the corner by the post office?
Yeah.
Yeah, the big house that was across the street
Yeah.
by Courtney Furniture Store. That was my house that I grew
Right.
up in.
They done tore that all that man.
They burned down.
He did.
Were you from Williamston?
Yeah.
That's why I knew your name when they told me
Yeah.
your name was Hilton Mobley. Yeah. I love Williamston. My mother, I don't know if you knew her. How long has it been since you've been in Williamston?
It's been like it was on the state over there.
My mother, did you know the Kings? James and Ellen King. Now you're closer to my mom's age, Patsy King.
I've heard them names
Yeah, she passed away,
Yeah.
like, I don't know, 20 years ago.
20 years ago.
Or even 30 years ago. She had cancer of the throat. But, okay. So now this would be when you got through filling, normally you would just turn it this way to step 4 and pin and close. And then we're going to close this. And then everybody pull your mask out. And every time before you get into the catheter, you hand sanitize. And this, when you were at home, you would go turn the air conditioner off. Or if you have vents in the floor, if you have something, you can cover them up. I have one guy, his are in the ceiling, but he has some magnetic thing to go up there. Otherwise, you just don't want any bacteria in here. Because I'm going to teach you about peritonitis when you get started, and that's the big fear, is the infection in the belly. But even that infection is limited to right there. But the thing about it is it can cause scarring of the membrane, and then it can make it not work as efficiently as a dialysis. And you know the interesting thing about PD? This was before hemodialysis. I'd never heard of it. I have been a nurse over 30 years. But it's really been around a long time. Okay, now, when we move this to the last part, it's pin and close. You see that right there? That's fibrin. That is what I was telling you about. And anytime you have fluid bloody like that, you're going to expect some of that. All right, let me wrap that up for you, and then you can get out of here, young man.
All right.
You can go about having fun now. What are you going to do fun today?
By tomorrow.
Huh?
Today.
Today?
I'm going to eat the first thing we're here.
Oh, what you going to eat?
I don't know.
Where you want to go?
It don't matter.
Are you on binders of Renvela?
Yeah.
Yeah.
I'm going to tell you, that is going to be a very critical medicine for you to take, okay?
All right.
Never skip that.
All right.
I'll teach you why when you come see me.
All right.
Did you put a tip or a top on that thing?
Yeah, when I did a pin and close,
Uh-huh.
that thing that had the fiber wrapped
Uh-huh.
around it,
Yeah.
that's a pin. And what that does is plug it
Okay.
so nothing goes in or out. And then I'm just gonna put this over this to kind of make you not have to look at it. And secure it a little bit for you, okay?
Oh, yeah.
And once you get all healed up, we have what we call a belt. And some people wear it up here and some people wear it around their belt.
Right.
And they can secure that catheter in there. After it's all healed, you don't have to wear a dressing on it. And some people choose not to.
Right.
But then you have to worry about trauma and getting caught in something. So I always advise it, but I like the belts a lot. And I'll get you a belt. But right now, you still like, can you see how it's more swollen over here than there?
Yeah.
He still has a lot of inflammation in that gut from that procedure. And you wouldn't have the right size now. You're going to be smaller by the time it's over.
So was that belt aggravate him like his heart monitor thing?
No,
let me
we
show-
won't.
It won't be that heavy.
It
No.
won't be that heavy?
This is, no, this is the belts.
Oh, okay, I see.
They're just, most people need a medium. I have a small and an extra large. Now I weigh 170 pounds and I can wear a small one. You know, and they're just Velcros.
Oh, okay.
And then they kind of,
Push, okay.
you know, and you stretch it out. And
Mm,
and it has a little pocket
mhm.
on one side or the other, right here, where the cap goes in there. And some people wear it up here, some people wear it down low. As long as you don't wear it over the exit side,
Right.
you're good. That's what you, because that'll put pressure on it. But these are like not really useful sizes for anybody, because even though I could wear a small, I would probably like a medium better.
Right.
Most people need a medium. So those are the belts, but like I say, I don't know why you don't have to be like extra large, but that's why I still have one. All right, that's it.
All right.